Now I will be explaining about the instrumental test and also the laboratory test. For the laboratory test, it is not specific, but we must undergo complete blood count, the blood chemistry test, and more specific tests that we must know is the bleeding time, the clotting time, and also the platelet count. But it's not specific. The first one is known as the handheld Doppler. So handheld Doppler is used to see if the blood flow is present in the vein and to see if it's only one direction, which is going upward. And we must see to determine that it is not going to the opposite side, which is downward of the isoline. If it's crossed over the isoline, meaning that it has venous reflux, which is a pathology. The next method is the best method, which is Doppler scanner, a form of ultrasound. Here we can see the structure of the vein, whether it is open or closed, and whether it is competent or not. And also we can see whether the vein is compressed or not. For my patient, the patient has incompetence vein, so the structure has changed. And also, if we use Doppler with the duplex scanner, we can access the blood flow and see if the blood flow is going to the opposite side or not. We can also add color to the test to see in a better image, such as vein in blue color and artery in red color. The next method is known as plethysmography. For this method, it is to see what kind of edema or is it edema present at the patient. So in the morning, the patient will put food in a container filled with water and the doctor will see how many water dispersed from the container. For example, if the water dispersed in the morning is 200 milliliter, it will be recorded. Next, in the evening, the patient will put food in the water to see if the water dispersed is more or not in the meaning. If it's more, for example, it's 300 milliliter, meaning that the patient has edema, the volume has increased. If it's equal, 200 milliliter in the morning, 200 milliliter in the evening, meaning that the treatment that the patient received for edema is working. The last method is known as phlebography. Here we use a contrast and we can see how does the blood in the vein flow. We can put in two methods, whether it is ascending at the foot level or descending at the groin level. We put at the descending in order to see if there's any venous incompetence. If we put the contrast will immediately go down due to the incompetence of the vein valve. In the descending, we can detect the blockage at the specific location of the thrombi.